Hi, I'm Constance Santego. What your mom never taught you about your feet. Let's start with shape. What's your ancestry? Where are you from? This is kind of cool. Look at how it goes. If your toes are slanted like this, Egyptian background. If the first three and then down, Roman, Greek. This little toe here is bigger than all the rest. And then it slants. Look how the Celtic, it's still bigger, but it kind of juts. And then from a German background, all across. Now this little toe being bigger is also called Morton's toe, just the guy's last name. But if you have this little toe and you don't wear proper shoes, because most of us are taught to buy shoes to the big toe, you really need to have lots of room for this toe, because if this toe bends, you can have pain all the way up your back to your jaw. So it's very important to have very good shoes that have lots of room for your toes. Each foot is made up of 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments, which all work together to provide support, balance, and mobility. The most common issue that I find seeing clients is the plantar fasciitis, and it's this muscle here, your flexor digitorum brevis. It's right in the middle. It attaches to your calcaneus and then all the little toes, and it doesn't attach to the big toe, it's only the four toes. But this one here, they call it an overuse issue, and it can give you severe pain. Usually the symptom is when you get out of bed first thing in the morning, you can barely walk. Now, the best thing for this is massage, reflexology, or even a body massage. You can also do it at home, maybe with a golf ball or something like that, and just rub your foot on the ball and help to relax this muscle. What special markings in your feet reveal your health? I want you first to know about zoning. So in reflexology, they call it zone therapy. And what you have is 10 zones, 5 on each foot, which spread up to the body, so split your body in half. So this foot is this half of the body, and this foot is this half of the body. Anywhere that an organ or any other part of the body that in that specific part of the zone, so you'll see the hands have 5, the feet have 5, and then they split right up the body. So the head actually has 10, so 5 on this side, 5 on this side. With that said, using reflexology, your feet hold the memory of your body's past health issues. Now, what a reflexologist can't tell you is when something happened to you and what it really is. We can only tell you where the issue is located. But working on clients for so many years, I will always mention the most common issues that a client usually answers. Seems like magic, but it's only science. What will your feet reveal? So what will your feet reveal? What is a reflexologist noticing? So what am I looking for? I'm looking for anything that's not normal. So meaning color differences, like if there's unusual redness and even whiteness. Calluses, bumps, pain if the client says that it hurts when I touch somewhere, rash, cuts, bruises, tightness of any of the muscles, and also bones protruding. Your toes are all about your head. They tell me the story about anything to do with shoulders up. So if I was looking at the plantar view of your foot, so this is the bottom of your foot, what I'm noticing is puffiness. So if underneath the pads of the toes is puffy, usual answer is always sinus issues. If there's calluses on top of the toes, usual answer is headaches. Now, right in here, if there is a bump and it feels like a little piece of sand, there's usually a pituitary issue going on. Now, any bumps anywhere on the toes is something to do with that area of the of whatever this map is showing us. Now, the shapes of the toes, usually it has something to do with the eyes and the ears. So these two here are eyes. These two here are ears. Now the dorsal view, so this is looking at your toenails, kind of looking down onto your foot. Now what you're looking here, again, maybe red marks. So what I'm looking for here is marks above and below kind of the knuckle, the little toe knuckle there, the little joint. Usually, if there's marks on most of them, the person has usually had braces. If it's only on one or maybe two, there's some major dental work being done. And the teeth, this would be closer to the outside of the mouth, like the back of the mouth, and this is closer to the inside. So remember, this is the half of the mouth, and then the other foot would be the other half of the mouth. Now, fluorescent white marks. This has been fascinating. Right down here, and I'm talking, the foot has this crazy white color that is underneath the nails. Not the moon, not the moon that you're seeing in the nails. This is in the skin, just underneath. And to me, I don't know how to explain it. You'd have to see it, but it's like a fluorescent white. And the answer that I've gotten from clients, because I know it has to do with the head, so what the answer has been is they've either had tumors, brain tumors, or they've had concussions. And that seems to be the usual answer to people. Callus on the sides, get into usually on this side, is mouth issues. Now the upper part of your foot is all about your chest. So there's the map. So what I'm looking for, and this is kind of the map of where the body is laid out onto the feet. Now calluses in this blue area is telling me that there's some kind of lung issue going on. People might have had asthma, bronchitis, things like that, but there's some kind of lung issue. Callus is on the outer edge here, like if it's in here on the blue on either side, usually the answer is they were a smoker. Calluses on the upward line, so this line going up here on either side of either foot here. This here, most common answer is they have acid reflux, but if not, a lot of times I ask if they were a singer or public speaker, that they use their voice a lot. It has to do with a throat issue, so some kind of throat issue. Now, the one that matters to me is there's a line sometimes that people get right under here, so right underneath this corner pad of it here, and it's like a groove in a person's foot. And this one here has something to do with the heart area. Most common answer is high-low blood pressure, but it can be anything up to a triple bypass. I've had clients say that when they were a baby, their heart valves didn't heal properly. It would still be there. Something to do with the heart. Tight muscles on the shoulders. So right in here, mostly here, but right in here, this would show me that they're tension, they hold their shoulders tight. Now when a bone protrudes over here, I know that they have had shoulder issues. And in here, if the bone protrudes, I know that they've had neck issues. Now when they have hardness up where they follow the groove, so this is the one foot, this is the other foot, hardness in here shows me that there could be a diaphragm issue that had happened or solar plex issues. And here, if they have solar plex issues, I know that they're stressed out. The dorsal side of the foot, so any bumps in this pink area, this here usually is like breast area and that, but any on the skin. So if we're going into the kind of the bones, like you're filling the bones, that's getting more into the rib stuff and that. And if there's a big bump, it usually is something to do with breast. But if it's these tiny little I'm going to call them like pimple bumps. They're not pimples, but they're kind of like these little tiny dots, these little bumps. Usually the answer there is shingles, or they've had a rash, or some kind of, sometimes it's cancer. Clients have told me that they've had different cancers, and there's these little tiny bumps that happen. Now, a hollow or an indent is telling me that they've had a breast operation. So usually when something's removed, it's amazing that the foot actually becomes hollow in that area. Now, in here on the teal side, if there's calluses, it's telling me that there's been an arm issue going on. And again, the bones protruding is ribs. The middle part of your foot is all about your digestion. So this is that soft spot in the foot. I'm looking for tight muscles, usually telling me that there's stress going on. Calluses, depending where they are, will be that part of the body. Hollow, again, it's usually an operation. Here, a lot of times what I'm feeling is gallbladder. A lot of times you can feel if the gallbladder has been removed. Sometimes there's hardness up here in the liver, and it's telling me that the liver has been having troubles in working harder than normal. Different pain, if clients have pain in this area, telling me something in their tummy is going on with their digestive system. Now the lower part of your foot is all about your hip region. So calluses, and again, depending where, means something to do with that area. Now, sciatic nerve is interesting because when this area has a bump or some kind of soreness to it, the doctors, like any scientist, will actually tell you that reflexology, a lot of scientists don't believe all this stuff, but it's the only true mark of the foot. So meaning the sciatic nerve actually ends there. And so when somebody has issue here, I know that they have some sciatic stuff happening from the hips down. Now, bumps in that, because I have over 20 years of experience, you'd be amazed at how accurate this is. Now, in here, when it's hollow, like meaning it kind of curves in, that the foot kind of curves more than normal, usually I can tell that somebody has bladder issues, and most of the time it's because they seem to have to get up in the middle of the night. So maybe their bladder in their real body has tilted, but it's showing me that there's some bladder stuff going on. Sciatic, what I'm looking for here, this is the outside of the foot. And this, lots of times in here, it's the lower back, but this here is puffy, really puffy. And when this is puffy, I always know, always, that right at this moment, they're having sciatic issues. In this corner here, a lot of times there's a bone protruding, and usually this is like anywhere along, so it's anywhere along the spinal column. But on the other side, so this is the inside of the foot, this is the outside of the foot, when there's a bone protruding, a lot of times it's actually knees that are giving them problems over here. Uterus, ovaries, but also testes and prostate. And what I find fascinating is when a woman is pregnant, this area of the body puffs up and changes, and then once she has the baby, it goes back to normal. I find that so exciting. Now, massage and reflexology are two of the best treatments to help your feet. Also, though, an Epsom salt soak is absolutely beneficial. The biggest part is the magnesium in the Epsom salts, and with just a minimum of 20-minute soak, don't care what temperature of water you do, your body will feel such an amazing relief. And for those of you guys that are athletes, the next morning, if you do this at night, the next morning, you're going to feel awesome. So massaging the feet relieves sore muscles, improves circulation and the lymphatic system. It's amazing stress release and diminishes headaches. I have many clients that come because they have chronic headaches. They always know when they need their reflexology because their headaches come back. I have clients that are on about a 6-week time frame that they actually are headache-free for 6 weeks after having a reflexology session. Now, usually a client already knows everything I'm going to tell them, but are amazed, for one, that I can tell, and because the issues happened so many years ago. And a lot of times they don't write it down on their health forms, and I don't look at the health form first. I just have them hold on to it. I check their feet, usually takes me about 4 or 5 minutes, and then I'll tell them what their feet are telling me, and then I'll look at their chart to see how accurate I was. Where this is important for me is when a client does not know, or doesn't agree. So I tell them something about their feet, and they go, no. Well, I'm going to use the example of the heart mark. So there's a groove underneath the big pad, and the person says they have no heart issue. They have no knowledge of anything going on. This is when I tell them to go get a checkup with their doctor, because that mark means that something has happened to that heart at some time. And if not, then it's happening right now, and I'd rather them be safe than sorry. So with over 20 years of experience saying, yep, there is or was, but it's not my job to make them go to the doctor. I can't make anybody go to a doctor and get a checkup. All I can do is tell the story that your feet are telling me. So go ahead and show your mom what you just learned. With knowledge, shift happens. Create magic.